Hi Venus, this is Dr. Srikanth from Team MDS CONQUER. Now I'll be having a talk over dental histology. So I'll be covering as much stuff as possible within this limited time, but make a note, your dental pulse synopsis and the PP book stuff is mandatory, and I hope you have done it. And I want you to glance that at least like 1 hour once you're done with this video. Make sure histology is again a topic where you need to revise, okay, because logic based, application based questions will be very less, so they pick memory based as an option. So memory based subjects should be revised in the last 5 days. So let's start. So this is not basically from dental histology, but it is basically an area of choice that most of the papers set to pick, that is taken from your Phillips textbook. Okay, so they can ask you the content. Okay, they can ask you the water content is a question that is given. So check whether they're going to ask it as per volume or per weight. So dentin and enamel I have given, the inorganic content, organic content, and the water. So if water, you can simply remember enamel weight volume and dentin weight volume. So if they're asking water, it's going to be 1/6 and it's going to be 10/22. Okay, and I hope you can manage that inorganic or organic content, which is a well familiar question. The next goes is once they have asked this question, so what is this? This is the percentage of wet weight composition of enamel. Okay, so the water content in the secretory stage is 5 and in the maturation is 1. So the water content is decreasing from the initial phase to the last phase, whereas the mineral content is increasing and the protein content is decreasing. So this is very important. The next goes are the underlying stuff. Just go through the underlying stuff. At the surface, the modulus of elasticity is higher. The hardness is more on dentino-enamel junction. Okay, the hardness is more on dentino-enamel junction. Modulus of elasticity is higher at the surface, and the specific gravity values are important. Of course, it's 2.8 is for enamel, 2.2 is for your dentin, and 1.53 is for your nitrous oxide. Saliva is 1.008. The specific gravity, all these values are important to make a note. We have so many tables related to specific gravity of all the things which are important for examination of your PP books, and I hope you're done with that. Okay, so electric, the temperature resistance, they can ask you the temperature resistance value, and the electric resistance value they can ask, so please do make a note of this. And okay, semi-permeable membrane, enamel is a semi-permeable membrane permitting the passage of through a few materials, okay, that is 14C labeled urea or iodine, etc. So please do make a note of this. Then goes the chemical content, 96% of inorganic content, 4% of organic content. Two main groups, that is amelogenins and non-amelogenins. Amelogenins are low molecular weight, accounts 90%. They accounts high percentage, but they are low molecular weight. They are rich in HPGL. HPGL. Non-amelogenins are high molecular weight and they occupy 10%, and they are rich in GAS. GAS. I hope you're very clear. So this formula is a regularly asked question. I don't know why. So please do make a note. Structure of hydroxyapatite is hexagonal. I hope most of them are very familiar. The next comes is the hydroxyapatite center core or C axis of hydroxyl ions, around which the calcium and the phosphorus ions are arranged in the form of triangles. And during the formation, the magnesium can be the magnesium replaces the calcium and carbonate. Okay, so please do make a note. During the formation, magnesium can replace the calcium and carbonate can replace the hydroxyl ion. That's a very important thing to be noted, and this is an important point to add. The core of the crystals are rich in magnesium and carbonate. Okay, and make a note, this is a dry weight content. The major content in the enamel structure is not calcium, it is oxygen, that is 43.4%, and followed by the calcium, that is 36%, and followed by that phosphorus, it is 17.7%. The major content is oxygen. Don't get confused, this is a big trap. And next goes is the pH regulation during the enamel formation. So please do go through this contents. Mainly this is an area of focused, okay, how this pH is going to differ during the, and of course you need to make a note about the definition of buffering capacity of the saliva, and also already discussed buffering capacity is important in maintaining the pH levels in the saliva and plaque, and the buffering capacity of the saliva is main one which maintains the oral hemostasis. And make a note, the buffering capacity is the millimoles of NaOCl or HCl per ml required to cause a change of one unit, change of a unit in the pH value. So this is the millimole of either acid HCl or either base NaOHCl that is added per ml of saliva to change its pH by a normal value. That is what the buffering capacity. So there are three buffering capacities which are very, very important. The utmost important buffering capacity is the bicarbonate buffering capacity. And the second most important buffering capacity is the phosphate buffering capacity, which is contributed to some extent when there is low saliva flow. When you have low saliva flow, this phosphate buffering capacity is going to come into existence. The third system of buffering capacity is the protein system. It occurs in the low ranges of pH. That is, the buffering capacity of saliva is due to the macromolecule containing H bonding systems. And the next goes is you can identify the blood group of an individual by taking the salivary samples. That's an important point to be added. And you can know the or monitor the progesterone levels to find the ovulation time in the females. And of course, you can find the Na and K plus ratio in the saliva that helps in diagnosing the diseases like Addison's disease and the Cushing's disease. Do make a note of this. Hormonal levels, your levels of testosterone, insulin, and steroids can be determined in saliva too. And of course, H. pylori, which is the main causative culprit for the peptic ulcer, can also be diagnosed by using saliva. Of course, urease test is the best test to identify this, but you can identify the H. pylori by using some sort of things in saliva also. The biopsy of the minor salivary glands of the lip, very commonly asked question related to the Sjogren's syndrome. And do make a note of these composition parameters, that is the volume of saliva, or you can, like, they can ask you GAM or the immunoglobulins that are present in the saliva. Predominantly is IgA, okay, IgA immunoglobulin, that is the dimer form of IgA immunoglobulin which has J chain. J chain is present in the IgM and IgA. Okay, it holds five single units of IgM, it holds 2 single units of IgA, and most of them you know about this. Urea is present, uric acid is present. Okay, so you have all these growth factors, and do make a note of these values regularly. I mean, NEET is not much focused on memory based stuff according to 2020, but we have to get prepared for everything. Von Webber glands, these are the serous salivary glands. We have already discussed like different types of glands and what is their contribution. It is serous or mucous or mixed or predominantly something. We have discussed everything on the group. Just go back and check those pics or the notes that are posted on it. And do make a note, the lingual lipase is a very specific. Lipase is not secreted by saliva. It is lingual lipase which is secreted by saliva, and it's very specific to von Webber glands, and it is innervated by the glossopharyngeal nerve. Do make a note of this serous and mucous cells and their diagram based things. Okay, they can ask you such questions nowadays. Microscopic diagram based questions are seen very familiar in 2020 NEET exam, and of course we can encounter few more in 2021, which is going to be on December 16th. The next comes is the difference between the mucus. Okay, by learning these differences, it is very easy to identify the diagram based questions. So please go through all these lines which are underlined, which are very, 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 very important examination point of view. Then of course you have a question on this in 2020 NEET exam, and it's a most familiar, which is common repeat, not repeated in 1819, but it's a question that is given in 2017, and of course with a twist that is added in 2020. So what is this? Like, first of all, it is intracalytic ducts which opens into striated ducts and opens into excretory duct. Okay, so what changes that regularly occur? Saliva concentration, this was given. Okay, this was given, right? So this was given in 2020 NEET, and of course the lining, you have a low cuboidal cells here, you have a tall columnar cells here, you have a pseudo stratified columnar epithelium to stratified squamous epithelium here. And of course, you know, the smallest is this, the biggest is this, the intermediate is this. So there are a few other things that you have to make a note. Myoepithelial cells, they are present at the periphery of the duct. They are absent here, they are absent here. Okay, so please do add such important things which can be asked in the examination point of view. Then comes the between the different glands, and this is a table taken from the textbook, very important. Meckel's cartilage disappears at 24th week, whereas your parotid gland is 4 to 6, submandibular is 6 weeks, and sublingual is 8 to 12 weeks. And coming to the type of secretion, it is serous secretion, it is seromucous secretion, and it is mucoid secretion. Coming to the contribution, submandibular is going to provide the major contribution, that is 70%, and parotid is 25 and 5 it is. Okay, the largest gland is parotid gland, but the major contribution is by the sublingual and the ducts which opens it. 2017 question. Okay, so these are the most common things where the ducts are going to open is the most common question. So please do check it. When coming to the capsule is very thick and well developed here. Capsule is thin or absent, it is thin or absent. And coming to the nerve innervation, please do make a note of the nerves here, the facial nerve for the submandibular, facial nerve for the sublingual, and do make a note the blood supply, the lymphatic drainage and everything. Lysozyme is very predominant in the case of your submandibular. Okay, and when you're talking about the intercalated ducts are almost absent but rarely seen in the case of the sublingual. MLS activity is more. This is a question that is given previously in one of the AIMS examination. When you take food of rich carbohydrate, MLS is going to play a very vital role, right? So MLS activity is mainly concerned with the parotid gland when compared to any other type of glands. Okay, so please do make a note of these things. So they're gonna ask you this question, very familiar, easily asked. Cusp of Carabellae, where it is present. Okay, it's the fifth cusp for the smallest cusp. It is present lingual to the mesolingual cusp for the maxillary first molar. And coming to this, yeah, of course, these are the blood capillary systems which are present in the body. The first one is fenestrated capsules, the second one is continuous, the third one is discontinuous, fourth one is tight. And first and second types are most common in the case of your dental pulp. These are present in the human body. All the four types are present in the human body. When you're talking about the dental pulp, the first and second, that is the fenestration capsules and the continuous capsules, are most common in the dental pulp. And coming to the enzymatic activity, nowadays you can see 2020 NEET has lots of questions on enzymes. I mean, most of them are related to general medicine and physio part, but of course they can ask questions in this particular area also. Okay, so which cells have which activity more is a regularly asked question. For example, if you talk about the odontoblasts and odontocytes, you have alkaline phosphatase, which is more active. Class, they cause resorption. You have acidic phosphatase that is more active, right? And similarly, class will have more cytochrome oxidase and will have more succinic dehydrogenase. So please do make a note of all these things which can be asked in the examination. And the next comes as the accessory canals. How the accessory canals form, that is a break or I mean like entrapment of the vessels, blood vessels during the foundation. Okay, so where you can see accessory canals. So endodontically, what are the importance of accessory canals? These are the areas where you have this connection between the endo and perio leading to endoperio lesions, and these are the areas which has to be cleaned properly because your irrigation systems were not well developed to reach these areas and to remove the irritants or the bacterials or the bacterial products in these areas. So it's going to be very difficult to treat, and the remaining bacteria may cause the reinfection, causing poor prognosis. So coming to the apical foramens, the main important thing is apical foramen size. In the case of maxilla is 0.4 and the mandible is 0.3. Sometimes you have 2 to 3 splitted apical foramens. The entire area is called as an apical delta. The functions of the pulp has induction function, formative function, nutritive function, protective sensory, and defensive reparatory. And the primary function of the pulp is formation of dentin. Okay, formative function is the primary function of the pulp, which helps in the formation of dentin. The dentin is formed first, followed by you have that enamel. The first layer of dentin is formed by the pulp. So it is most important step required in the formation of a dentition. Okay, so the next comes is the histological layers of the pulp, that is odontoblastic layer, cell-free zone of Ville, and rich zone, other names of the rich zone, core, the central part. Okay, cell-free zone. Please do make a note. Approximately 40 microns thickness. It is also called a cell poor zone. No cells are present in this, and I mean few unmyelinated fibers. So that is plexus of Ashcroft's very close to this. And please do make a note, presence or absence of the cell-free zone depends upon the functional status of the pulp. It may be, it may not be appear in the case of very young pulp, and it may not be appear in the case of very old pulp. Cell-rich zone, which is filled with lots of cells, that is your fibroblasts are the most common cells, followed by the undifferentiated mesenchymal cells, which can be differentiated into any type basing upon the stimulus that is given by the pulp. Okay, so these are the first predominant cells, and followed by undifferentiated mesenchymal cells are the second predominant cells. Coming to the fibers, you can see elastic fibers surrounded by the vessels, and the main function of elastic fibers is to keep pressure so that the blood is going to move circular. And the next one is the collagen fibers, which forms the body of the pulp. The type of collagen fibers that are present in the pulp are type 1 and type 3. Type 1 is predominant when compared to the type 3 in the ratio of 55:45. So I mean regularly enamel doesn't have no collagen in enamel. Type 1 collagen is present in the dentin. Type 1 collagen and type 3 collagens are present in the case of PDL. In every part you have mostly type 1 that is the predominant. So of course this is a question that is given in the examination, okay, in an endo point of view in the last year. That is during the pulpotomy procedures, the barbed broach should be engaged in the apical region, because apical 1/3 has more collagen. So compared to the coronal 1/3, the apical 1/3 matrix contains more collagen, which is fibrous and whitish. So you have to keep your broach at the apical 1/3 and turn it so that the barbs which are present on the broach are going to lock the collagen fibers, and the pulp can be removed in one shot. So these are the blood pressure values. See the pulp, where does the pulp stands? They can give a sequence based question on this. And basically the pulpal pressure influenced by the vascular tone in the neighboring tissues, because how the neighboring tissues are going to react is how the dynamics of blood variations in the pulp. And this is the theory which is going to explain that. Don't go very deep into the theory, but do make a note. What is the Stilling theory says? That Stilling theory says that the pulpal blood flow is influenced by the vascular tone of the surrounding periodontium or surrounding structures in it. And do make a note, this makes the pulp more available to the clinical situations when a simple application of matrix band lead to gingival inflammation, but could affect the pulpal tissue also. But how the pulp is going to save itself is this theory is going to explain. And coming to the innovation, we have already discussed about this. You have more unmyelinated C fibers which are present at the center. You can see C fibers at the center, that is core fibers, and you can see all the A fibers which are present in the periphery. Periphery is A fibers and central core is the C fibers, and 75% are the C fibers which are unmyelinated slow fibers, whereas 25% are myelinated, your A delta fibers. Okay, so in that A fibers, the major content of A fibers is going to be A delta, that is 90% is A delta, and very few cases you can see A beta fibers. Coming to the pulpal calcifications or the pulpal stones, which are common occurrence, and it is basically age related. These types of pulpal calcifications, pulpal stones, which comes under the dystrophic calcifications. So please do make a note, in your general path your calcifications are important. That is your dystrophic calcifications and metastatic calcifications. What is the difference between them? What is the examples? Everything were covered in the mock exams. If you're not clear, just go back and see. This is a very important area. So basing upon the structure, it can be true pulp stone or a false pulp stone. And basing upon the size, it may be fine or diffuse, and basing upon the location, it can be free, attached, or it can be embedded. Okay, so please do add a note of this line. So they can ask you diagram based questions, so please do watch, try to understand. Histological diagram based questions are common, so I don't want you to miss any of these. And HERS, that is head fixed epithelial root sheet and root formation. You hope you're very familiar with this, and it contains of inner and outer enamel epithelium only. You can see this inner and outer enamel epithelium, this inner outer part and inner part. And spongy bone. So spongy bone fills the areas between the cortical plates and the alveolar bone proper. And most of this bone marrow have particular types of cells like pluripotent cells, which can be differentiated into any type of cells. The cancellous component in the mandible is more than in the maxilla is more than in the mandible. And if you take the types of radiographic examinations, the allelus is divided into two types, that is a type 1 and type 2. Type 1 are regular and horizontal ladder like arrangement, and type 2 are irregular. So please do go through this content. This content is important. Lactoferrin being questions are being asked in the lactoferrin. Already we have learned about the saliva and the components of saliva. So it's a lactoferrin is a bactericidal, it has a bactericidal effect due to its strong iron binding capacity. It removes the iron from the solution and makes it unavailable as an essential bacterial nutrient. So that is the main reason how the lactoferrin is going to work on. Coming to the stages of tooth development, that is, hope you are very familiar with the stages too. Please do go back. We have given 2 or 3 questions in various mock examinations explaining all the content related to the histological diagram based content related to your bell stays, cap stays, early bell stays, advanced bell stays, cup stays, and everything. So please go with this histological diagrams, because 2020 they have asked and there are high chances to repeat those examinations. And what are the morphological changes and how they are physiologically related? Initiation takes place in the dental lamellae, whereas proliferation, where does it take place? Histodifferentiation, morphodifferentiation. What are the consequences of histodifferentiation? It means you will have the histological defects like amelogenesis imperfect, dentinogenesis imperfect. All these comes under histological defect in histological differentiation. Morphological differentiation is change in shape. Your dilaceration and everything, like they comes in the change in shape. And the number of teeth problems comes in the initiation. So please do make a note of all these things. Dental lamella, okay, the total activity of dental lamella extends over a period of at least 5 years. So please do make a note of the rest of rhesus. Sex determination for the teeth, okay, mainly by, you have something called as an amelogenin. We have already learned amelogenesis and non-amelogenesis. In that, amelogenesis is a major matrix protein that is secreted by the ameloblast, which has different codings in male and female. For example, they code XY. In female, they have two two identical amelogenin genes, whereas in the male, they have two different. So this gene helps in identifying the sex determination in the human beings. Just by taking the teeth, you can identify whether it is a male patient or a female patient. So microwave processing, these are some advanced histological things which are frequently asked nowadays in the examination. So microwave oven processing has been successful and easily accepted in many laboratories. And microwave works on the principle of causing molecules to rotate rapidly and collide, and results in internal heat production simultaneously. Okay, thus, if you compare this is a very, very important thing. So it requires much lesser time than the conventional methods, and the tissue can be sectioned and strained within 4 to 6 hours. That's a primary advantage. So just go with the underlined stuff. And these are the few areas where you need to make a note of this underlined stuff. Okay, of course, this is the most familiar question. 10% of formalin is the most commonly used fixant. Okay, and the other important things that you have to make a note: extracted teeth are stored in, okay, regular question. Most of you get confused with hydrogen peroxide, but extracted teeth should be stored and preserved in 10% as formalin until they are used. Okay, so xylem free tissue processing and staining, just go with this. This is the question once given. Okay, the uses of xylem, it takes place in 2 minutes. And what are the steps in this? Okay, what are the steps in this and everything are very, very important. So please do go with this. We have discussed everything in detail on the groups. Okay, just go with this, because it's going to take 1 or 2 minutes, not more than that. But they can ask, because if they want to throw a new question in dental history, this is the area of choice to throw new questions, because most of are unaware, and if you open your basic MCQ books, they doesn't touch this area. Yeah, I'm done for now. Signing off, Dr. Srikanth from Team MDS CONQUER. All the best. Stay positive. Make a note. Spend 1 hour, one and a half hour time with dental histology, like like you can like this video is going to be half an hour, you can spend other 1.5 hour. So 2 hours, 2 hours is very sufficient time for dental hist. And make sure you try to cover the synopsis part of your PV books, as well as, I mean, like hardly like 10 to 15 pages, and followed by the synopsis of your dental pulse. And yeah, that's all the best. Bye, take care.